Good morning. Today I'm going to be educating my patient on how to properly use insulin. My name is Esmeralda Serrano and I'm going to be your MA for today. Can you please verify your name and date of birth?
Good morning. My name is Emily Soslanda. I was born February 13, 2005.
Okay. So today I'm going to be teaching you on how to properly use, storage, and apply your insulin and the things that you're going to need at home. So you're going to need your insulin, your syringe, 2 alcohol pads, some gloves, and if you don't have any gloves, make sure that you wash your hands and you disinfect yourself with some hand sanitizer. So first I'm gonna start on where to store the insulin, which is gonna be in a room temperature. You also need to check the expiration date, and if the insulin is cloudy, you don't need to shake it. You're gonna grab it with both of your hands and roll it in between. And after you apply the insulin, you're not gonna massage the area where you apply the medication. Some of the places that you can use to apply the insulin are gonna be your thighs, your stomach, and the side of your arm. So now when you're applying, you're gonna wash your hands first, or if you have your glove, you put them on. So you're gonna grab the insulin and take off the cap, and where the rubber is, you're gonna clean it with an alcohol wipe. And then on your syringe, the amount of medication that the doctor prescribed, for instance 20 units, you're gonna here put 20, and then you're gonna inject the same amount of air that the medication you're gonna take out. So you inject it and then you invert the bottle, and you're gonna make sure that the needle is below the medication. And then if you have any bubbles, you tap on the syringe until all the bubbles are up here. Then you're gonna recap your syringe using a Watt method hand. So you're just gonna do this, and then after you put the cap on. So on some of the sides that you can inject the insulin, it's on your thighs, on your stomach, and on the side of your arm, on the back. So you just, when you inject on your stomach, you need to make sure that it's 2 inches from your belly button. Then you're gonna get an alcohol swab, and then you're gonna clean the area, and then you're gonna let it dry by itself, and then you uncap the needle and make sure that you inject at a 90-degree angle. You're gonna pinch your skin, so you inject, then you put the medication, and then after that you're gonna leave it for 10 seconds so that the medication can get absorbed. Then you remove it, and you don't need to massage the area. For example, if the physician prescribed a cloudy insulin, remember that you don't need to shake it. You're just gonna roll it in between your hands, and then you do the same procedure. The same amount of air that you're gonna inject in, you're gonna take out. You make sure that there's no bubbles, and then if you're gonna inject in the same area, the stomach, make sure that it's 2 inches from where you inject the other medication already. So when you finish, you're gonna discard everything that you use. You're gonna recap the needle using the one hand method. After the cap is on, then you put it on. You're gonna throw it in a sharp container. If you don't have any, you can use a detergent bottle and then put it inside. As well, if you have any cotton balls or alcohol pads that has blood in it, you're gonna throw it, and then you're gonna cap the detergent bottle. If it doesn't have any blood, you can throw it in the regular trash. So after you take it, make sure that you don't take any herbal medication, because it may alter your glucose level. So it's preferably that you don't use it. Do you have any questions?
No.